Hello, this is Charmaine Carter again. Um, Talking to you again about what's going on with my surgery. I was going to put all my makeup on and everything, but honestly, I'm 1 week away and I'm really not trying to deal with that right now. Not feeling it. Just not. So, this is the real Charmaine with the bags and the eyes and the whole 9 yards and my lovely little hair in a bag or sleep cap. Anyway, I haven't talked to anybody over about a week now, and I did say I was gonna do it every day, but it's it's a lot of emotions going for me. I 1 minute I want to cry, the next minute I want to scream, the next minute I just get overwhelmed about so much that's going on. And I know it's major surgery, but of course, the doctors and nurses are trying to downplay it's not that bad, and I'm sitting there going, yeah, but paralyzation, death, kind of bad. So let me tell you what's going on or what went on last week. Last week, I went to physical therapy on Monday at Bon Secours St. Mary's Hospital. The orthopedic, Ortho Virginia, I actually went to. And when he saw the x rays or the MRI that I had done for my neck and upper back, he was like, why are you here for physical therapy? Because you have surgery scheduled. And I'm like, yep, I do have surgery scheduled. He was like, I think probably thought you could do just physical therapy until he got the MRI. Yeah, I think so too. So we basically sat there and we talked about some of my questions I had. For instance, for anybody who might have want to do this surgery, and again, the name of the surgery is Anterior Cervical Discectomy and Fusion. They also have one where you use a disc replacement, but mine's just going to be a fusion to make sure that it doesn't pinch my nerves anymore. So they're literally going to cut this way, get in there, probably suck out some of this fat out of the way, and take the discs that are in me and takes skin graft and put it together, and then put metal screws in it to make sure the spacing is correct. So right now we have the spacing going like this. We want to make sure the spacing is like that. So we put the metal screws in there and fuse this on the back so that way it won't collapse. It can't collapse. With the screws over here and that over there, it can't collapse anymore. Because right now, the main cause of all this, like I said before, is my osteoarthritis. And my osteoarthritis basically simply means the cushion or the gel between bones is deteriorating on my body. It is deteriorating pretty much all over my body. This is in the neck, but I also have no cartilage in my right knee because in your knees and your joints, like these kind of joints, is called cartilage. And here we have a little disc and we have little cushions in there, but all of them are the same thing. It's deteriorating. I'm basically losing all the cushion between my bones, which makes it harder to move, which makes it stiffer, which can cause pain and irritation. This is what I'm dealing with. It's going all over my body. As you can see, my teeth are out of whack. It also affected my teeth as well, the bones, and all that started deteriorating in my mouth as well. So it's like I said, it's all over my body. Um, this is what's going on. This is what caused this problem. It's not anything I did. It's not my exercising. It's not my non-exercising. It's not the foods I ate or didn't eat. It's literally my osteoarthritis wearing away at all of the gels or cushions between bones. That's what caused all of this. And unfortunately, I probably have a family history of it, but my family, I've talked about this before, abusive, dysfunctional family. My family doesn't talk about, well, anything. Excuse me, not anything related, family related. They gossip about other things and other people, but their own health issues that are going on that might be, genetically passed on to their children or grandchildren, they don't talk about. They don't talk about the abuse. They don't talk about that kind of stuff, which, unfortunately for me, ends up with me finding out I have issues after I have the issues, which is one of the reasons why I'm telling my son ahead of time the things I have going on with me so that he can check to make sure that he doesn't get that, and doesn't come out of the blue out surprise. So as I said, I went to the physical therapist on Monday and we talked about what's going to happen to me. We talked about recovery time or approximate recovery time. We talked about more so about the after the surgery, because since he's physical therapy, he can't do too much about the surgery. He's seen people do it before, so he knows a little bit of something. But we were talking about after surgery. I told him I got some weights and the little brace weights that can go your ankle, on your wrist or your ankle. And what it is it's a 1 pound weight. And I know that after surgery, just letting y'all know that you're gonna have to keep moving. And when you're in pain, it's hard to keep moving because you need to make sure your circulation keeps going. So I'm using the 1 pound weights to put on my arms so I can do exercises to keep my blood flowing and not to make sure I don't have any blood clots, and also to make sure that my muscles don't get weaker because I'm, laying in bed because of this thing. Also, and I wanted to make sure that was okay with him, and he said that's fine. He said I could do that to start out with, and then as time goes on, I could maybe increase it to 3 or 4 pounds. But after a couple of weeks, maybe close to a month, I will be going to physical therapy after that to make sure that um, I can move my neck and my head the way I need to. Unfortunately, well, we'll talk about that in a second. And so we talked about that. I also asked him about pillows because I know per Google, because Google's our friend. I learned per Google that I'm gonna have to have a neck brace, a real plastic neck brace to put on my neck, and that means going to sleep at night on the bed. I'm not gonna be able to twist my head or my neck, so I wanted to find out if I should get a pillow, like one of those wedge pillows, to kind of help me sleep better, so I can have my head at an angle and not move my neck because I'm not gonna be able to really, and so I can get comfortable to go to sleep. We talked about that. I also talked about, well, how long am I going to be in the brace? And, he gave me an estimate, but he wasn't quite sure. And we talked about those kinds of things. And he actually showed me, because he does do physical therapy, he actually had a skeleton that actually showed the neck. And it showed how everything was going to work and how the brace is going to be and the fusion is going to be. And he also told me that they will probably be getting the bone graft, since I actually haven't talked to the doctor. Doctor didn't say about doing surgery for that. They'll probably get a bone graft from a cadaver, which is a dead body, and use that to fuse the vertebrae back together, which makes sense. Um, and we pretty much did that. He did check out my neck to see my range of motion. He also told me that after the surgery, my range of motion will be limited. So I can do like this right now, which basically gets my head all the way to almost to my ear, to my elbow. But after I have the surgery, it's gonna be more like this. I'm not gonna be able to get all the way down like that. Same thing with my head moving forward. I can go over there here and put my neck on my chin to my chest, but after the surgery, it's gonna be more like this, or more like this kind of thing. I'm not gonna be able to go all the way down. And so he told me about all that and showed me basically how my range of motion is going to be changed a little bit, which is why I'm having to do physical therapy to get used to my peripheral vision. I'm not going to be able to see like I used to be able to see. For instance, if I was driving a car, I'm not going to be able to do it all like this. My be able to twist my head is going to be limited. So that's what we're going to do with physical therapy. And that's what he talked about on physical therapy on Monday. I'm actually going to upload the pictures of some of the things I took for physical therapy. They had this gorgeous water fountain kind of in the front. I'll put it on YouTube for you to see. Wednesday, I had to go get more tests done. And I also went to my diabetic um, dietitian, if you want to call it. Because I am diabetic, I also have to make sure that I change my eating habits and eat properly, because now I'm going to be stuck in bed for at least 4 to 6 weeks. I need to make sure that I'm able to eat stuff that's good for me, as well as not eat too much sugary stuff, because if my sugar level is off, it can also cause more inflammation, which is the bad thing that's happened to me after having surgery, because that means it's already going to be inflamed anyway, because they cut and move stuff around. So of course it's going to take swelling and stuff down. But to make sure if I eat too much or too little for sugar, I can cause the inflammation in my body to act up, and we don't want that as well. So they were talking about, nutrition, and I have this big, huge book for diabetic stuff. So there we are. And actually, I'll show y'all that later on to let you see what's going on. And on Thursday, I went to Parham Doctor's Hospital for my pre-authorization, pre-op visit, and an assessment. So, blood work, they did more blood, of course. They also, first and foremost, this place is beautiful. I got pictures of that too. I'm going to show that to you too. This place is absolutely wonderful. I absolutely love the facility. The only problem I had is that, I have osteoarthritis. I told you that my right knee has no cartilage. It's a long building. And depending on where you go in, you have to walk to the other building to get to where you need to go to. So I'm supposed to be going to the surgical unit, ortho surgical unit at Parham's doctor's office, Parham's doctor hospital, excuse me. And with that, I had to, the Uber, because I can't drive anymore. The Uber dropped us off at the front of the front of the building. There's a long corridor that I had to walk all the way down because the surgical department is in the back of the building, which means to go all the way around. Okay, well, now the surgical office I went to, nice plush seats. They even have chargers for you to charge up your phones or electronic devices if you need to. Very comfortable. Not water fountain. One where you can put the cup underneath of it, that kind of thing. Absolutely wonderful. And when I went there, because I did blood work, they got my weight, my height, because they need to know how much anesthesia to give me based on my height, based on my weight. They don't want to give me too little, they don't give me too much, so they had to know my weight was. And get blood work. And she also did my blood pressure. They asked me a whole lot of questions. My blood pressure was 180 over 110, which is not good. It's far from good. And she was telling me about, what could happen if I don't and I need to get my blood pressure down, because if I don't get my blood pressure down, I can't have the surgery done. Which freaked me out because I didn't realize my blood pressure was that high. But I was also nervous and scared. Well, I was nervous and scared because of the needle. I'm not big with the needles. But now that I've been taking shots for Ozempic for the diabetes and shots in my stomach for allergy medications, the needle doesn't quite scare me as much as it did. I still like it, but whatever. I also had to find out that they don't do the IVs and the arm like I thought they were going to do. They're going to do it in my hand, which is going to hurt. I'm not looking forward to that at all. I have really sensitive skin, and needles in my hands causes my hand to bruise and swell, and I don't like it. But I need to have the surgery done. I've been doing more and more. I've been walking. The more and more I've been trying to cook and get the house ready before the surgery, so that after I come back, I don't have to worry about doing too much. The more and more my back hurts. It is. I can't stay in the kitchen and cook too long. I can't stay in the kitchen at all too long. It starts to hurt my back. And even I'm moving around and constantly moving around, it doesn't make a difference. It's the floor. And the living room, the living room, my bedroom, the hallway is all carpeted, so it doesn't bother me quite as much. But the kitchen is my favorite place. I love to cook, as you can tell by my double chin and cheeks. But it's getting harder and harder, so I know I need to have the surgery done. So what I've been doing is they increased my medication. I've been taking my increased medication for my high blood pressure every day. and I also have a blood pressure machine. It's, excuse me, right here. I bought it earlier this year. And what it is it's basically just like I said, it's a blood pressure machine. It has the cuff in here and the actual machine right here. I got it from Amazon, and it actually does take my blood pressure, and it keeps everything, and it also keeps a record of it on my phone and on the machine. And my blood pressure actually got down to 132/90, which the bottom number was still a little high, but it's better than that 180 or 100 and something. We don't want that number. So at least the medicine is working, is getting me down. So I'm hoping by the time I have the surgery, not this Monday, but next Monday, my blood pressure will be totally under control. I'm going to keep checking on it daily to make sure it still stays down. And I'm also going to make sure I go to the doctor on Wednesday, if the blood pressure is not steadily at the 130 something range, which I'm hoping it will be. And now I'm just really nervous about doing the surgery. When I went to the hospital for the pre-authorization test, after we finished the testing, the blood pressure, the weight, the height, the blood work, to fill out the paperwork, they also took me upstairs and gave me this booklet about what to expect for the surgery, during the surgery, after the surgery. And the good news is that when I have the surgery, of course, I'm going to be there, and we go upstairs to like the third floor of the building, and that's where my room is going to be. It's a private room, which I really didn't care because I'm going to be out of it most of the time. But they're going to let my son stay with me so that I can feel comfortable, and, as I try to deal with the new norm of norm. Also, they told me that I should be out for about 6 weeks approximately for the surgery, for recovery. That's barring no complications or any issues, which they'll know more when they actually get into cutting me open. They talked about how the procedure is going, and everybody in the room, besides everybody else in the room, including me, are all getting the same kind of procedure from the same doctor. So, yay. So which tells me his success rate is really high. We talked about the equipment I'm gonna need to get. I have a grabber thing they wanted me to make sure I have, which is one of these. I got one of these to make sure. I also had to place orders for t-shirts for a V-neck one, because I have to have, like I told you, a brace that goes all across here, all the way up here, and it goes all across my neck. And if I have the round shirt, it might cause problems. But if I have a V-neck shirt, it'll go right here in there, and it'll go, because the thing goes down to about here, so right about here. And so I have to get a V-neck shirt, which I've ordered for them to come. And I've also got the pillow that's coming, that I got the pillow with the arms, so I can have basically like sitting like this and going to sleep. I also have more pillows to go on my back in case, it causes too much pressure on my lower back, kind of thing. And they also told me I had to drink some Gatorade. Is for people who are diabetic. It doesn't have as much sugar as everything. They want to make sure I have enough electrolytes in my system, so when they do the surgery that I don't crash afterwards, because it'll take a couple of hours to do this, one. And two, I will be losing some blood because they are cutting into my body and, and doing stuff. So they want to make sure my sugar level won't crash and burn, kind of thing. So it's just that when you were talking about it, it just made it so real, which is probably one of the reasons why I haven't posted anything, because it's like, it's one thing to talk about it in theory and what's going to happen, and it's no whole other thing to actually talk about it with a professional and break it down by bits and pieces and stuff. And it was something. It was something. They also told me that I will be getting whatever devices I need to help me out, to get better. For instance, I'm going to get one to help me put my socks on, because I don't have one of those things, because I'm not going to be able to bend down and put my sock on. I'm going to have to do the whole head down to do the sock on, or the whole head, and my can not going to go by so far because the neck brace is going to stop me from bending all the way down. Also, I'm gonna have to walk a different way, which they're gonna help me before I leave. Because I normally when you walk, I know I do. I would tend to look down at my feet when I'm walking. I can't do that. My head's not gonna go down that way. At least for the first month. So I'm gonna have to walk like almost like a mummy with kind of thing, with my head straight and my I can't say my arms straight, but my head straight, looking straight forward, and I can't really look down. The other problem that's coming with this is that now that I'm on real short-term leave because of the surgery, I've got my first real paycheck, and it's pretty much half of what I used to have. So now, on top of that, I have to worry about how am I going to eat, because I still have to pay the rent and all the other bills. How am I going to pay the rent and the other bills? I mean, it becomes a thing of how am I going to pay everything? That's the issue I have right now. How am I going to pay everything? Now I'm good for the month of June, but July is coming around the corner, and when the time I have the surgery, it's only going to be like 1 week left, and then it's going to be July, and I don't know where I'm going to get the money to do all this stuff. I'm praying to God to help me with all this. I did file for disability. I also talked to Medicaid, which I am on, and I talked to Meals on Wheels, and I'm trying to get meals delivered to me because I'm not going to be able to cook because the brace. I also talked to Medicaid about having a companion or home health aide to help me out because I'm not going to be able to do a whole lot. My son's going to try to help me out as much as he can, but he still has a day job. So this is me trying to deal with not only a major surgery coming up, but trying to take care of the household things at the same time. It's a lot. It's a lot. And I'm trying to keep it together. And I'm watching my podcast. I'm watching my pastor on TV for church so that I could get some spiritual uplifting because Lord knows I need it right now. So I'm trying my best to keep it together. So this is the last week before I have my surgery. I have no idea what's going on. I know I have to go see my primary care physician again on Tuesday this week. And then Thursday, I have to go see the diabetic person again to, do more stuff about my diet and what I'm going to do and what I can't be able to do. It's just a lot. So I thank all of y'all for giving me your well wishes and, prayers because I'm going to need it. And I'm trying my best to hold it together as much as I can because I still have to live. I still have to do day-to-day stuff. I still have to, wash my butt and brush my teeth and do my hair and eat and all this stuff. So thank you for your well wishes and your love, and I appreciate it. And have a nice day.